I'm Colleen Pearce and I'm the Public Advocate in Victoria.
Thank you very much for talking at the end of a big day, really. What were the main messages you wanted to bring to this conversation about ageing and mental health?
The key message for me is the issue of the human rights of people as they age. We often forget about that. What we see is the overriding of a person's will and preference in many, many ways. I would see people on day in, day out in residential aged care who say, I don't want to be here. They don't want to be there. So who is authorising their stay? Why do they have to stay? What's their will and preference, and how do we give effect to that? How can we support people to continue to exercise autonomy and self-determination as they age and to be listened to and heard? And some of that is tied up in the place of older people in our society. As we get older, we get more invisible. People don't see us. They don't listen to us. They don't listen to our voices. I hear about intergenerational change, and that means older people moving on to the scrap heap. So for me, one of the key take-home messages is the importance of empowering older people, ensuring that their human rights are respected. And one of the key ways we can do that in residential aged care, where we see an over-reliance on medications to control behaviours that aren't necessarily related to a psychiatric condition, is to have an oversight mechanism. We have this mechanism in disability services. Indeed, the new National Disability Safeguarding Commission has a whole focus on the authorisation of restrictive practices on people with disabilities. Why don't we have something similar for older people? How is it that people can be detained in residential aged care facilities against their will, medicated in a way that's unauthorised?
So how is it that that is the case? What has stopped us? What are the barriers? Which are the groups that you need to convince? Or are we waiting for governments to act on that?
Well, if we're waiting for governments to act, I suggest we'll be waiting for a very long time. But there does need to be others speaking out against the restrictive practices against older people, which generally is chemical restraint. It can be a physical restraint, but more often than not it's going to be some form of chemical restraint authorised by a GP and possibly not reviewed or inappropriate in the first place. So we don't have doctors who have we don't have many doctors with a strong interest in geriatric care, and as a consequence, for many people in residential aged care, they don't see the doctor that they may have seen when they're in the community. They see the doctor that comes, and there isn't always an understanding of the impact of dementia. So we need to change a whole lot of practices. We need to change the workforce. We need to change the way we view people. We need to be far more respectful of older people, and we need to ensure that we abide by certain decision-making principles, and that is people have the right to autonomous self-determined decisions for as long as they can, that they should be supported to exercise their will and preference, and that should be listened to and heard.
You talked also about many other people and groups that you represent. Can you talk about some of those intersectional issues with aged care, with ageing and mental health?
Look, I think one of the issues is that we know certain sectors in our society age at a faster rate. So Aboriginal people, homeless people, people with chronic mental illness, they may be considered to have aged at an earlier date. And in the past, we may have been successful in getting them access to aged care services. Now, under the age of 65, you're to access NDIS services, and many of this group with episodic needs or who may have difficulty in presenting to authorities or interacting with health services because of their negative experience of health services, or government, so don't want to access the NDIS, yet can't access aged care services, which they once typically might have done. So we're seeing a real gap in the service system, not in theory, but in practice.
And Are they having their voices heard in these current discussions?
We're talking about some of the most marginalised people in our community, and some voices are being heard. The Victorian Royal Commission into Mental Health has specifically looked at the mental health of Aboriginal people, and that is very important and quite significant. But to date, we haven't seen as much concentrating on some of the other specific groups, such as people with disability, people who are homeless, so older people. So we'd like to see some of those and some of their needs really a focus of the Royal Commission in the days to come.
You've been here all day. Do you have any? What have you been your sort of the messages that you've picked up through here that either give you hope or concern?
Well, I think the emphasis, the very strong emphasis that people want to see on early intervention and prevention, and a move away from the focus on the tertiary services. Now, that's a long-term strategy. We have a lot of people who are older who have mental health issues, who need those tertiary end services, but we know they're not always meeting their needs. But more emphasis on early intervention and prevention, a real desire to see a workforce that is appropriately trained to recognise the needs of people as they age, and to be better trained not to rely on medication in the first instance. And I think when we did the poll, human rights, while not the number one priority, was up there. And it's really good to see that people are talking about the human rights of older people. And
were you a little sad to see it drop down slowly?
I was. It did drop down slowly, but it was still up there. And we don't talk enough about rights. And I think human rights gives us a framework to understand systems and to ensure that they are really person-centred, consumer-directed, not directed by the service provider. So rights are really held by the individual.
Because that's the big issue, of course, beyond the ageing and mental health issue, but within mental health, in any case, around the use of seclusion, restraint, etc. That's a big rights issue. Are you feeling like there's some traction being gained now around that, or is it still a struggle?
Look, I think in acute mental health services there has been a national approach to the reduction of seclusion and restraint. So we see that in our mental health services. We don't see it in the prison system, where we have large numbers of people who have mental health issues, who may be subject to seclusion because of behaviour, which may be a result of their mental health issues, so it's not as strong in other sectors. But really it's the restraint of older people. The predominant restraint is the chemical restraint of older people, and the use of polypharmacy is the large number of medications that people are prescribed. So that's really at the heart of what we need to see. We need to see an oversight of restrictive practices, particularly in residential aged care, against people who are residing in those facilities.
Thank you very much.